Hey everyone, and welcome. Today we are going to talk about something that almost all of us have to deal with at some point, trying to find the right words to describe our pain. It sounds so simple, right? But getting it right can absolutely change everything about your healthcare. So let's dive in and build up our vocabulary.
So picture this. You're in the doctor's office. They look at you and ask, "So, what's going on?" And your mind just goes blank. You might say something like, it just hurts, but you know there's more to it. It's a really stressful moment. And that feeling can be even bigger if you're trying to figure out a new healthcare system or maybe even talking in a language that's not your first.
But what if you had the right words ready to go? Having a specific vocabulary for your pain isn't about trying to sound like a medical expert. It's really about giving your doctor a clearer map of what's happening inside your body, and that can lead to a way faster and more accurate diagnosis.
Now, for today's guide, we are leaning on the amazing work being done by the Health Fluency Project. Their whole goal is to make health information super clear and easy for everyone to understand, which is exactly what we're aiming for here. I want you to think of the words we're about to go over as tools for your very own toolbox. Each word helps you build a much clearer picture of your health for your doctor. And the more precise the tool you use, the better the final result is going to be.
All right, so the first way we can start sorting out pain is by thinking about time. How long have you been feeling it? Is this a brand new thing that just popped up, or is it something that's been hanging around for a while?
Okay, so let's break this down. On one side, you've got acute pain. This is that sudden, sharp feeling, like when you sprain your ankle. It's basically your body's alarm system screaming, "Hey, something's wrong here." And it usually gets better as your body heals. But then, on the other side, you have chronic pain. This is the kind that sticks around for the long haul. We're talking more than 6 months. It might be a dull ache, or it could be severe, but because it's always there, it can cause other problems, like making your muscles all tense and just draining your energy. Okay, so we've got the timing down. Next up, let's play detective and figure out where the pain is coming from. Knowing the source is another huge piece of the puzzle for your doctor, so let's add a couple more really useful words to our toolbox. First, we have something called visceral pain. This is that deep down pain that comes from your internal organs. Now, the tricky thing with this one is that it can be really hard to pinpoint. You might feel this general, vague ache in your stomach area, but you can't point to one single spot and say, "It hurts right here."
And this is perfect because here are the exact words you can use. Does it feel like a heavy pressure or maybe a deep, constant aching? How about a squeezing or a cramping feeling? Even just saying it feels like a bad stomach ache gives your doctor really important clues about what could be going on inside. Then you have a totally different kind of pain, neuropathic. This isn't coming from an organ or a muscle. This pain is actually caused by damage to the nervous system itself. Think of it like the wiring in your body is a little haywire, and it's sending pain signals by mistake. And wow, the words for this one are so specific and so different. Just listen to this. Does the pain feel like a sudden electric shock? Or maybe a constant, hot, burning sensation? Or is it a sharp, shooting pain that travels, maybe from your back down your leg? These descriptions point right to a nerve problem.
Okay, that was a lot of new info, I know. We've talked about pain based on how long it lasts and where it comes from. So let's just do a quick huddle and put all these key ideas together in one spot. And here it is, basically your cheat sheet for pain. So remember, we've got pain based on duration. That's acute, which is short and intense, and chronic, which is long-term and just lingers. And then we have pain based on source. Visceral, that deep squeezing feeling from your organs, and neuropathic, that burning or shooting pain from the nerves. This little table is your new best friend.
And this is why it all matters so much. When you use specific words like shooting instead of just hurts, you're building a bridge of understanding. This is so, so important, especially if you're navigating a language barrier. These words help you, they help a translator if you're using one, and they absolutely help your doctor get right to the heart of the problem so much faster. So I'll leave you with this question to think about. By learning this vocabulary, you are giving yourself the power to tell your own health story with confidence and clarity. So which of these new words are you going to put in your toolbox to make sure your story gets heard?